First, live, local. This is Fox 12 Now.
All right, we are back here with Fox 12 Now, and again, as always, thank you for joining us live streaming out of the Fox 12 Oregon newsroom. We cover a wide range of topics, and the topic at hand today has to do with all of the wildfires that are going on in the state of Oregon, and not just the burning, not just the loss of land, structures, and all of that that's going on, but also the health concerns that come with smoke. This is from Air Now. This is an interactive map kind of showing air quality in the state. Over here on the west side, we've had that wind come through, so a lot of that wildfire smoke has gone back over to the other side, the stuff we were seeing last week. You can see what they're dealing with over here, though. This is Oregon. That's central and eastern Oregon, and then into Idaho as well. Some areas just extremely unhealthy. And we want to talk about that and some of the concerns that can come from wildfire smoke and just how you can even protect yourself from that. To do so, we've got right now Dr. Allada joining us. And Doctor, thank you very much for being here to talk about this, to cover this. Really appreciate it. To start off, would you mind just telling us, well, a little bit about yourself and your role there, but then also just what these big concerns are that you're seeing?
Yeah, absolutely. Thanks for having me. Yeah, I'm the pulmonary clinic director at Oregon Health Sciences University. I've been here in Oregon since 1999. I've definitely seen my fair share of the smoke that we're all dealing with right now. Yeah, this is really a big problem, and it seems to be an annual problem here in the Pacific Northwest. And what we're seeing is a lot of ambient particulate matter that comes from these wildfire smokes that is particularly challenging for specific high-risk groups. And what I usually talk about are folks that are actually at the extremes of age, toddlers all the way up to our elderly folks. And then those who particularly have lung and heart problems, and then pregnancy. Those are the folks that are at most risk for breathing these dangerous matters.
Yeah, so those particular age groups being at most risk, and as you mentioned, if you've been here since '99, you've certainly seen a lot of these fires that come through, and it does seem like over the last several years, it's really an annual thing instead of every other year, a massive amount. Looking at this kind of smoke, like this map behind me showing some of these different colors of the concerns there. At what point does it become concerning for you for the smoke, and when should people really start paying attention to maybe change their outdoor activities?
Yeah, I mean, I love that you pulled up that map. I was actually looking at that map right now, and if you actually pull back, this is the worst in the entire country right now, which is amazing. But I think if you ever hear about something from this great station and on public health sort of blogs and stuff, that you hear there's an issue, that should warn you right off the bat. The problem is you may not feel it. Even if the air quality is maybe in those yellow zones, you may not feel it. I'm particularly concerned, as I referenced before, if you have heart and lung issues, you may actually feel it a little bit earlier. So if you're ever having any symptoms, and that can range from itchy, watery eyes, you're coughing a little bit more, you're clearing your throat a little bit more, even if you don't see it in the air, this is a warning sign that tells you that something may be going on, and getting back indoors to safety is better.
Got it. So paying attention to that, actually, if we could talk about that just a little bit more too, like those symptoms, starting off, what can you recognize in yourself? But then when we're talking about perhaps some of those populations, especially younger kids, they may not even know how to express it. So what are some different things you can look out for to where it becomes, and I guess how far does it go before it becomes a concern that you need to go seek medical attention?
Yeah, that's a great question. I mean, even healthy people like you and me, if it hits our eyes, we may feel our eyes scratching. It hits our nose, we may feel our nose running a little bit more. The back of our throat may feel scratchy, and then we may cough more. The issue is, if we know we're healthy and if we're not too disturbed by that, it doesn't necessarily mandate seeking attention. But in folks who have lung disease, let's say emphysema or asthma, the rapidity of how bad those symptoms can get may be much faster. So those folks particularly need to call out to their healthcare teams and their clinics to make sure if they're having a problem to call that out. The other thing that's important for those specific groups is if they're on some chronic medications that they take to help manage those conditions, it's really going to be important for them to be really adherent to those treatments so that the impact of the smoke is less.
And to the idea of making that impact less when it comes to the smoke, are there things that you can do if you do have to go outside? Is it wear a mask, or is there a particular kind of, I guess, protective equipment that you could use?
Yeah, great question. Obviously, rule one is limit your exposure to going outside, but we're a social species, so we do have to go outside, get our groceries and whatnot, especially if you're at high risk. Wearing those N95 masks that we, had and we accumulated when COVID was around, they actually work great for wildfire smoke. The problem a lot of people have is they may use, sort of a lesser quality mask. And to some extent, that actually may actually bring a little bit more danger because it can give a false sense of security. But those, whether it's a handkerchief or a bandana, they will block out larger particles that would have hit the back of your throat. But the smaller particles that get into your lungs and irritate your lung tissues, those actually go right through those lesser quality masks. So make sure you get a high quality mask if you have, especially if you have problems with breathing this.
Gotcha. So those N95 ones that you may still have from COVID and all of that, if for I know for a lot of people, those are what we can utilize for that. That's great to know. Anything else that you think is important for people just to consider and be aware of?
Absolutely. Just remember those high risk groups. I would also add, people who work outdoors for a living really have to keep our eyes on those folks. But even if you're not one of those groups, if you have friends or family members who fit into those categories, give them a phone call, see how they're doing, make sure they're doing okay, make sure they're taking their medications and support them when we can.
All right, Doctor, thank you very much for joining us, just to talk about this and get some education out there for people and just to be aware and cognizant of what's going on and looking at maps like these so everybody knows that this is a public map you can pull up, but there's lots of places yet to get that idea of air quality. I mean, if you're in this zone, it's bad. You don't need to look at a map for that, but certainly, yeah, be aware of all of that. Doctor, thanks for joining us here on Fox 12 Now.
Thanks for having me.
And for everybody watching, again, we are live here out of the newsroom. We're going to be covering quite a bit of topics here over the afternoon. We are going to hear from the public information officer for the Grasshopper Fire. So that's one of the newer fires that started on Mount Hood. Something to be concerned with there. We're seeing these fires pop up all over the place. It's extremely dry out there, so we'll get you some information on that one and the spread of that, what you should know. We'll also hear from one of our meteorologists that's going to be joining us to give you an update on just where the weather's at, how that's affecting the fires as well. But we do need to take a quick break, so we're going to do that. We're back here in a couple of minutes with more Fox 12 Now.